Hello, everyone. My name is Steve Hofford, and I'm owner and pharmacist of Magnolia Pharmacy. Want to thank you all for joining tonight to talk about methylene blue. This is a topic that's kind of newer to me, kind of newer to us as on the pharmacy side. We've known a lot about methylene blue, but to have access to a quality chemical that we can compound with is relatively new. So with that said, that's what we're going to talk about tonight. Want to talk about a couple things. If you'll please make sure you have yourself on mute. It'll just make it easier for conversations, background noise, and for everybody else to be able to hear clearly. The information tonight is strictly for educational purposes and for you to learn. I am not here to treat, diagnose, or cure any disease. The information tonight is strictly for your educational purposes. And if you do have questions about your health conditions, and whether or not methylene blue would be good for you, highly recommend you talk to your healthcare practitioner about that. Want to thank everybody, like you said, tonight for joining. We had a lot of great questions that come in beforehand. I ask you tonight, as tonight's presentation goes, you can put questions in the chat. If we have time at the end, we'll answer them. For those that we can't get to at the very end, we will push out an FAQ at the end to make sure that we get all your questions answered as far as that goes. So I just wanted to start with that as far as that goes. I'm going to jump right into the presentation because it's going to take right about an hour, I think, to get through everything. So give me just 1 second to get my screen up and we will get started. All right, everybody should be able to see now. So talking about methylene blue, obviously got a big, nice blue background as far as that goes. Methylene blue actually was originally developed as a dye for blue jeans. It's one of those type things, as with many drugs, we start out with one thing and find out it does something else. Believe it or not, it was the first synthetic drug that was actually approved in the United States back in 1876. Couple of tidbits as a pharmacist that I found very interesting was it was used early as a placebo in a lot of drug trials, so that when they gave patients the methylene blue, they knew if they were taking it because it would discolor the urine to a blue color, and they would find out if they weren't taking it because it wouldn't discolor urine. Found that very interesting. Methylene blue, though, actually was first used in a lot of our military troops to treat malaria. Methylene blue, if you look at it as a derivative, it ends up being very chemically structured to many of our first malaria drugs, but it itself was actually used to treat malaria back in the late 1800s. Believe it or not, to this day, methylene blue is pretty much carried at every hospital. It's used for overdoses and poisonings of cyanide, carbon monoxide, and things like that. So every hospital is actually required to keep methylene blue in stock. Also, too, kind of as a side effect, when methylene blue is produced, it actually led into some of our first antipsychotic medications, some of the early antipsychotic medications for like schizophrenia, and some of our earlier nausea medications like chlorpromazine and promethazine were actually early derivatives of methylene blue. So found that kind of interesting in terms of the functions in terms of methylene blue and what it can do as far as that goes. The next big thing that I think is important to keep in mind with methylene blue is that it actually led to the development of other drugs. So keep that in mind, as even though it was an old drug, it actually led to many other drugs moving forward. So early uses of it actually was an antimicrobial activity, that it was used as a therapeutic dye. It was used for staining of cells. A lot of times, what's kind of unique about methylene blue, it typically goes to the part of the cell that's the most productive. We'll talk about that in a second. So it's great to use as a stain for type of cells. It also, as a dye, can show certain type of differentiation in cells and being able to look at those. It also, too, is used for some cancer chemotherapeutic uses. And it also has psychoactive uses for dementia and psychosis. Other clinical uses, and probably the big thing that actually methylene blue is approved for, is actually the therapy for methemoglobinemia. It's a condition where the red blood cells do not carry oxygen the way they should, and methylene blue can solve that problem. It's also used for septic shock. It's used for encephalopathies, ischemia, where poor blood flow is involved, and we're going to talk a lot about that because that's really how methylene blue works. Used for malaria, it's actually making a comeback. Some of our malaria drugs have lost some of their potency, and it's been actually added back in some of the malaria regimens. Also for surgical stainings, I know if there's certain bladder procedures and certain that are done in hospitals, the methylene blue is used for a dye. Now, one of the things to keep in mind about methylene blue, actually, it was part of an old urinary antiseptic that we actually, when I first became a pharmacist, it was kind of a product that was used for bladder urinary antiseptic for chronic urinary infections or chronic spasms of the bladder. Can't even talk. So those are just some of the clinical uses of methylene blue outside of what we will discuss in tonight's presentation. So let's kind of break down and let's talk about methylene blue and its effects. It all starts with the mitochondria. If you look at methylene blue and what it does, we're going to talk a lot about the effects of the mitochondria. And if you go back to your science days, we'll talk about a cell. It's got a nucleus, it's got the endoplasmic reticulum, and it's got different types of parts of the cell. But the mitochondria, if you remember, goes back to the days where we learned in school, it was the powerhouse of the cell. It's where the body generates its energy, and it makes ATP. If you think of ATP, ATP is basically the currency of the body. It's what the body uses to carry out all functions. And without ATP, we wouldn't live but a matter of seconds, we would die. And our body is constantly producing this. And mitochondria are all throughout our cells. Some cells in the body have 1 or 2 mitochondria. Certain parts of the body, for instance, like our central nervous system, our brain, has thousands of mitochondria per cell because the energy requirement to keep our brains alive and thinking and functioning is very large. So that's the main function of our mitochondria. Keep in mind, though, too, in the process, you think of anything in life, when you make something, i.e. make energy, which a mitochondria do, we produce waste products, and those are called reactive oxygen species. They can have a negative impact on the body in terms of causing disease, triggering our immune system and inflammation. So that's also a function of mitochondria. Mitochondria, though, in addition, can do things like regulate our amino acids, regulate metabolites. It affects our neurotransmitter function. We'll talk about that. It can affect insulin secretion, and it also has an effect on how our body makes and stores lipids. But just keep in mind, within each of our cells, there's something called a mitochondria that makes energy. And we kind of got a little blow-up diagram to show that. Now let's talk about this. When our mitochondria are dysfunctional or dysregulated, we can have a lot of problems. Remember, we talked about it's where all the energy of the body goes on. And there are many things that can affect our mitochondria. And that's what's important when we talk about a wellness type about a health approach to taking wellness and healing. Our mitochondria become very important to that. If we look at many diseases nowadays, there's 2 things that kind of set up all disease. One is inflammation, and the other is mitochondrial dysfunction. So let's just talk about some of the things that can make our mitochondria not be as efficient as what they used to be. So the first thing is aging. So unfortunately, as with anything, whether it be our cars, whether it be other things, our mitochondria over time begin to break down. They don't function as well. They don't do as well. And with that said, aging can have a big impact on our ability to have energy. Think about how our brains work as we get older, how our muscle aches and pains happen as we get older. And all that has to do with this mitochondrial function beginning to decline as we age. Next thing is hormone imbalances. Our hormones are natural signals to the body to do certain things. And one of those things our bodies do when our hormones are out of balance is our mitochondria do not function as well. The next thing is our thyroid. If you think in terms of your mitochondria is where energy is made, metabolism happens. Well, thyroid is one of the hormones that drives that process. When our thyroid is dysfunctional, our mitochondria are dysfunctional. Poor nutrition and diet. If you think about your diet, you eat a lot of carbohydrates, fats, and protein. And believe it or not, these fats and your carbohydrates are a lot of the initial fuel the body needs to drive the mitochondrial process. If we eat poor diets with poor carbohydrates and poor fats, our mitochondria don't operate as efficiently as what they should. Vitamin and mineral deficiencies. Many of us now, even if we try to eat the most healthy diet we can, the way our food is produced, we don't have the ability to get as many vitamins and minerals that we need. And there are vitamins and minerals that are very critical along the process of a mitochondrial function. And we'll talk about that in a second. Prescription medications. Believe it or not, there's a lot of prescription medications that make our mitochondria not work as well as what they should. So that's important. Infections, whether they be things as simple as a COVID virus infection, but also things like Lyme disease. We can have concurrent gingival infections, gum infections, underlying infections that we may not even realize, but these basically make our mitochondria less functional. Toxins, heavy metals, toxins and heavy metals clog up this process of metabolism, and those can cause some problems. And there's a whole host of other things. But what I want you to realize is two things. One, mitochondria are essential for life. If we don't have them, we don't survive. But unfortunately, too, there are many things we do every day that can have an impact. And that's where Methylene Blue comes in. All of these items on this list we're talking about need to be addressed and worked on. But we also want to look at what are some other things that may allow our body to have functional, high-performing mitochondria while we're working on these other things that may allow us to have success and help with the energy production in the body. Well, guess where it comes along? That's where our Methylene Blue comes along. Because what we've learned is all of these conditions here, and you can see there's a whole host of them. Some of these are medical conditions, and some of these are just symptoms from arthritis to chronic illness, dementia, diabetes, hearing loss, hypoglycemia, migraines, neurological conditions. All of these conditions can be related to poor functioning mitochondria. And like we talked about, every cell in the body has those. Every cell in the body has to produce energy. And if we don't produce energy properly, the cells can't function right. Within the cells, the organ can't function right. And then outside of that, the body as a whole can't function right. So that's where Methylene Blue comes along. And we're going to dive into this a little bit. And I apologize. I want to kind of cover a lot of details. I don't want to bore you with details, but you really need to understand the science to understand why Methylene Blue works. What I think is really exciting, not only do we have a lot of patients on tonight, I have a lot of prescribers that are on tonight that want to learn about Methylene Blue. So we're going to kind of take a deeper dive to understand. Really, once you kind of look at it, it's not that complicated, but just to kind of understand. So within the mitochondria, if you look at it, it's kind of what Hal was explained to me. And I want to start out too, as we go into this data now, and tell you, I really want to thank two people tonight for our talk. One is Sarah Hover with PCCA. It's one of our companies that we have a great relationship that we purchase a lot of our chemicals from, and our compounding. They're all about quality, just like us. A lot of the material tonight is from a talk that she gave several weeks back. I also want to give credit to Dr. Bean from the Frontline Care Group. He's a physician that did a lot of really great talks on Methylene Blue and the actual scientific mechanisms of how it works. And much of their information is included tonight. And I want to thank them. And I have a little slide at the end to also give that credit, but I want to bring that out. But if you look at the mitochondria, it's basically a double membrane organism that basically folds upon itself. And the reason it folds upon itself is each of these surfaces has a function. And the mitochondria is within this mitochondria is where cell production takes place. And the way I can best explain, or I heard it explained, it's like a purse within a purse. And the reason for that is in a minute, we'll talk about that. But within this is where basically energy production occurs, ATP is produced. And throughout that, through this metabolism process, the side effects or the kind of the discharge that happens are what's called reactive oxygen species, or ROS. And those have a role in terms of needing to be cleaned up over time. So that's our mitochondria, to keep it pretty simple. So what I want to talk about is up here in this drawing is a picture of what I just showed you. It's basically a cell membrane within a cell membrane, and it's got these folds upon itself. And all along the ridges in this, and this is kind of blown up diagram here below of this little square in the diagram, all down here within these cell walls are something that's called an electron transport chain. Big long word. Basically, it's how the mitochondria makes its energy. And then the other thing that's part of this electron transport chain is this called ATP synthase. And all this basically means is, to make it really simple, is this is how the body makes your ATP. And I'll kind of walk you through this process quickly, not to get into details, but I want you to understand, because you have to understand this to understand how methylene blue is going to work. So basically what happens is when we eat food, when we eat basically carbohydrates and fat, our bodies make the fuel that drives this process. And that's this process down here. And through this process, if you think of it, it's nothing, things are going to come in and things are going to come out. We eat food, and the food that we eat gives this electron transport chain the fuel that it needs to basically pump out electrons out of this inner membrane, if you look at the thing here, into this intermembrane space. So what happens is, you think about something. Let's use basically like a diagram in terms of what we do if we're going to try to create what's called a gradient. If we push something really, really far one way, which means if we fill this inner membrane space full of electrons, at some point there's so many electrons here in this space, the laws of physics and the laws of nature say, hey, we got to come back the other way. And what happens is all of those electrons that have been pumped out here in this inner membrane space go through this gradient and come back through this ATP synthase. And if you think of it like a big turbine, it's over here spinning. So we pump things out, they come back in, and when they come back in, this ATP synthase begins to churn. And when it churns, every time it churns, it generates ATP. And like we talked about, ATP is the energy currency of the body. Without ATP, I couldn't give this talk. I wouldn't function but a second. I would be dead. Think about this. This goes on millions and millions of times per second in the body. So you have to think about how important this process is. So the basics of this process, once again, is we eat food. The body takes that food and generates a currency that works for this system. Our body then pumps out or pushes out electrons into this inner membrane space. That gradient, the excess amount of electrons that are produced, flows back through this ATP synthase. The turbine wheel spins, and on the backside, our body generates ATP. It's what we use to live. So keep in mind, through this process, electrons float from 1 to 2 to 3 to 4. But when that electron gets worked and used, once again, remember how we produce byproducts? We actually produce what's called these reactive oxygen species. And that's why we also have to have oxygen here. This is where the oxygen we breathe comes in. Our oxygen here can actually scavenge up these byproducts, and our body creates water. It actually makes water at this point. So the point is, this is this process that goes on and on and on throughout our processes to produce energy. So as we go along, just following the slides here, the cell membranes of the mitochondria are loaded full of enzymes. The big one that we're going to talk about for tonight is this electron transport chain. We got ATP synthase that makes ATP, and these are very sensitive in terms of how they work. Remember, these items here pump electrons into the inner membrane space, and then this gradient or this turbine produces ATP. Now, let's talk about the next process in this. With methylene blue, what happens is, in a normal functioning mitochondria, this process goes on, everything's happy. We produce enough byproducts, but not too many byproducts so that the body can clean those up. We make ATP, and the cycle repeats itself. But a couple different things can happen. When we have a tissue that does not, remember we talked about you have to have oxygen present down here to scavenge up these free radicals. You also have to eat good food. You also have to have, and the way that the body gets your nutrients to these cells is by something called nitric oxide. We've heard about that a lot. Nitric oxide dilates blood vessels. Well, why does it dilate blood vessels? It dilates blood vessels so that the body can carry blood to these cells so that we can get oxygen and nutrients. Remember, the nutrients down here are what drives this electron transport chain. Oxygen's what's needed to complete this process. And in a happy, wonderful, healthy cell, everything works great. But remember the list of things that I showed you that basically can affect our mitochondria? Well, one of those things can be basically an ischemic event. And what that means is that's a tissue that no longer gets enough oxygen to survive. You can think of things like heart attacks and strokes. More importantly, like we talked about, one of the cells or one of the organs in the body are the systems in the body that has thousands of mitochondria per cell is our central nervous system and our brain. And that's one of the things we're going to talk a lot about tonight, why methylene blue has such a tremendous impact on the brain and our neurocognitive function is because this process has happened in millions of times per second. Well, what happens is if we don't have enough oxygen and we don't have enough nutrients, this process goes awry. And what's really kind of scary about this is when this process goes awry, the body kind of goes in a stress mode. And this stress mode does two things. These byproducts, if this process happens and we don't have enough oxygen, the body actually will begin to leak out these waste products, these reactive oxygen species. And unfortunately, in the body, they have a really negative effect. They cause our proteins to get misfolded. They send a signal to our immune system saying, hey, immune system, my mitochondria, this cell isn't functioning very well, and you may need to come clean me up. And actually, the body may actually then send a signal and go take and eat and destroy that cell. Well, as we talked about, some of these are our brain cells. We don't want to lose those. And that's the important part that can happen if we don't have enough oxygen. If we don't have enough nutrients, this cell don't produce enough ATP. That sends a signal to the body to say, hey, this cell's not doing what it should. Man, this cell is dysfunctional. The body then may say, hey, we need to send the immune system to clean that up. So these are just some things that go on in the system on a regular basis. Now here comes methylene blue. Methylene blue comes in and does a couple really, really unique things. So in a case where we don't have enough nutrients to feed the cell, or in a case where we don't have enough oxygen to basically fix the cell and help it do its own thing in terms of getting rid of some of the byproducts, methylene blue comes in and does three really unique things. So the first thing methylene blue can come in the absence of nutrients, that's in the absence of carbohydrates and fat, which are the feeders for this electron transport chain, methylene blue can come in on its own and donate electrons. That means give it the fuel to pump out the electrons into that intramembrane space and still create the gradient, even if it doesn't have the nutrients to do so. So in an oxygen-derived tissue, no nutrients, methylene blue can actually allow the body to still allow this process to happen, even if it doesn't have the nutrients. That's the first thing methylene blue can do. The next thing that methylene blue can do is when it comes into the cell, it actually has the ability to come in here and scavenge up even more oxygen. And what did I say a while ago? No oxygen, we got problems. But when there's low oxygen, the body's pretty smart. Our cells have the ability to say, uh-oh, there's no oxygen. Methylene blue is taking even more of this oxygen. It sends a signal out to the body, and the body then has the ability to say, uh-oh, we need more nitric oxide. And what do we say nitric oxide does? Nitric oxide dilates the blood vessels to allow more oxygen and allow more nutrient to get to that cell. So that's a really unique benefit in terms of what methylene blue can do. It can actually stimulate the body to produce more nitric oxide to feed this cell and keep it healthy. The last thing that methylene blue does, it's really kind of unique. Methylene blue has the ability to take away, and it also has the ability to accept. Methylene blue can actually scavenge up. Remember those byproducts I told you, these reactive oxygen species, which send bad signals to the body? Methylene blue can actually scavenge up these reactive oxygen species and basically carry those away and pull those off. So the body doesn't think the cell is in danger or in stress and want to come take care of it. So those are three really unique mechanisms beyond other things that methylene blue can do that are really important in terms of the mitochondria and its function and how it works. And basically that's what my notes over here talk about in terms of its ability to allow this whole electron transport chain to work. It can actually take and get more oxygen to the tissues. And basically, it prevents the body from signaling that, hey, we need to clean up this cell and get rid of it. So I just want to kind of walk you through that again. I know it's a lot of information, but it's not more complicated. Remember, ischemic tissue with low oxygen creates mitochondrial damage. The mitochondria can't make as much ATP. We have lower energy. When we have low energy, more of these reactors and oxygen species escape. We have cell damage. The body responds. Methylene Blue can donate and accept electrons. It can harvest O2 to the cell and bring more O2 and oxygen to the cell and nutrients because of nitric oxide production. It restores the dysfunctional ATP production. And by doing so, it doesn't allow the body to trigger inflammation because it thinks the cell's going to die. So let's talk about methylene blue. So it sounds like a really great chemical, but there's a lot of kind of nuances about it that have to be looked at. First of all, methylene blue is really unique because it has stimulatory beneficial effects at these low doses. But if we push really high doses, actually methylene blue can be very, very harmful to the cell. So I just want to stress that. And that's important. If you go to read studies, you need to look at what the dosing is. And we'll talk a little bit about that in a minute. For instance, one of the biggest conditions right now that methylene blue is noted for is what's called methemoglobinemia. Once again, it's where the body's red blood cells can't carry oxygen like they should. And we've already talked about how methylene blue can really do unique things with oxygen. Well, believe it or not, at really low doses, methylene blue can benefit this condition. But if you take a person with methemoglobinemia and you give them too much methylene blue, you'll actually make their red blood cells even more dysfunctional. So the dose is very important. And so keep that in mind in terms of whether you're looking at studies, doing research, reading stuff on the internet, talking to your prescriber. As a prescriber, it's important that we keep that in mind when we're doing dosing. So what are some other properties of methylene blue? Believe it or not, it's kind of unique. Methylene blue is what it is. It is actually blue. I'll show you at the slide at the end, but it is deep blue. But what's really unique is when it begins to do some of its property, that means donating electrons, helping with oxygen, it actually goes to colorless. It's kind of unique in that sense. So keep in mind, it's that colored dye aspect is what actually allows it to be a dye. If it didn't do what it does, it would never go to the white state, but it's through its process of working is when it changes colors. Methylene blue is what's called hydrophilic and lipophilic. That means it loves water and it loves fat. And because of that, that's what allows methylene blue to have the ability to cross from your gastrointestinal tract, get absorbed in your system, but cross that cell membrane to get within the cell. The other thing is it's a very small molecule, which that's why allows it to get what's called past our blood-brain barrier. Our body has a natural barrier to protect our brain from a lot of things. But methylene blue has such a small size, it actually can cross that blood-brain barrier. And that's why it's so effective to treat a lot of conditions regarding the brain. Once again, methylene blue reduces those reactive oxygen species. And therefore, like he said, methylene blue has the potential to protect cells against oxidative stress. That means situations where the body needs more oxygen, but it can't get it, that cause a lot of those medical conditions that we talked about on the slide. So now I'm going to kind of go into some studies that are in the literature. That's what's really unique. I did a PubMed search of just articles in 2023. PubMed is basically our go-to source. It's like the old days. We always have to go to a big medical library. We can now go to PubMed, and PubMed puts out reviews and abstracts of all of the clinical literature that's out there in the world right now. And this is, like you said, worldwide. There have been over almost 2,000 journal articles on methylene blue just in the last year. So methylene blue is really taken off. But I want to talk about some specific conditions with the methylene blue, and then we'll get into some of the basics of dosing in that. But methylene blue, first of all, has been shown to be very unique in COVID. And one of the things it does, like we talked about during COVID, we found out during COVID, the body can be very and beneficial in terms of protecting itself with if you have adequate amounts of zinc on board. Well, methylene blue actually allows the zinc to go into the cell, one of the benefits. Methylene blue actually also interferes with the ability or helps with the ability of zinc to not allow the virus to replicate itself. And so that's important. Methylene blue also has the ability to lower the pH within the cell, and it prevents the virus itself, what's called uncoating, or allowing it to kind of start the process to take over our own cells. And methylene blue also has the ability to bind the viral spike protein and prevent it from actually entering the cell itself. So these are just some things in an article I found very interesting, how methylene blue can be helpful for people with COVID. One of the really unique things about methylene blue, this was a study done with cancer patients who just happened to be doing methylene blue at the same time the COVID pandemic happened. And what they found was really interesting is when they look back at it, all of the patients that were on methylene blue for cancer, also none of them developed the influenza, the flu, or COVID at the same time versus the ones that weren't on methylene blue, which I found that really interesting, which kind of tells methylene blue can potentially have a big benefit in terms of preventing COVID just because it's natural properties. And like I said, it talks really more about, this article does, about how methylene blue probably prevents actually the COVID actually from binding to the cells and starting the infection process. Found that very interesting. So that's some stuff with COVID and methylene blue. Alzheimer's disease. So keep in mind, methylene blue has been shown to attenuate the formation of the amyloid plaques. There's kind of two big things, and there's kind of two thoughts with Alzheimer's disease. We pretty much know on the wellness side, it's really an inflammatory driven process. And these amyloid plaques, which many of the commercially available drugs nowadays go after to target, it's really almost like we're really kind of trying to put some water on the smoke, and we're not going after the fire. But there's another aspect, which are these what are called tau proteins, where basically these proteins get misformed, and it's thought to be an inflammatory driven process. And the other thing that's thought to do with Alzheimer's disease, there's thought to be some neurotransmitter issues between our serotonin, our choline, and they can also play a part of the cognitive aspects of Alzheimer's disease. And some recent studies have shown that methylene blue may have a benefit in terms of our patients with Alzheimer's, in terms of improving the cellular function in the brain and its potential benefits for methylene blue and Alzheimer's disease. This was a really interesting article here that talked about methylene blue and its cognitive performance in patients. And I'll tell you about a lot of these studies. Many of these studies had humans involved, and a lot of these were rat studies, because some of the things that were done, we really don't want to perform on humans in terms of some of the benefit, but a lot of it has to do with doing some of these effects on rats and then actually looking at their brains afterwards and the benefits that occurred. But in terms of methylene blue in this study, we talked about that tau protein, which are these proteins that misform in the brain that are thought to drive some of the problems in terms of the brain's misfunction with Alzheimer's disease. And methylene blue actually inhibited this tau phosphorylation, which actually prevented these some of these microneural tangles from forming. And with that said, it's really thought if these neurotangles happen, the body actually has the ability to come in with methylene blue. The methylene blue can tag these and actually allow the body to come in and clean up and scavenge up these misforming cells and allow the cells that are there to perform better. So once again, we don't really have a lot of great drugs on the market with methylene blue, but in terms of the cognitive function and what methylene blue for an Alzheimer's patient, it may show some benefit. This one I found really pretty interesting in terms of that goes. This one was a rat study, but basically this study it wanted to look at whether methylene blue, and I find this interesting as a wellness focused pharmacist, and I have a lot of practitioners on the night that are wellness focused. We have something that we talk a lot about, which is called leaky gut, and what you might call gastrointestinal hyperpermeability. And it's basically where, due to our diets and different things, our food and different things, the gut lining separates, and when that happens, we leak out what's called lipopolysaccharides. These are the cell walls off of the negative gram-negative bacteria in our gut. And unfortunately, these lipopolysaccharides, or I'm going to say LPSs, actually are great inflammatory triggers for the body. Anybody that does wellness understands this and is like, yes, I know exactly what you're talking about. It drives inflammation, and inflammation drives a whole host of other diseases. And I was looking at this article because it was kind of unique. They induced this LPS on these rats. And what they did is they allowed it, and we know what happens is when LPS hits the brain, it causes microglial inflammation. Microglial is basically our immune system of the brain. And when it gets cut on, it's hard to cut it off. And that's why when you think about it, if you eat a bad diet every day, you're cutting this on every day, and it leads to things like cognitive decline, confusion. You can't have good memory. It can cause headaches. It can cause enhanced aches and pains. And so what that said is they induced this in these rats. And then what was really neat is they gave methylene blue to these rats. And they looked at pro-inflammatory factors that are produced in the brain on these rats. And they actually found that methylene blue, when given to these rats that had this brain inflammation caused by this LPS, it resolved the neuronal inflammation. And it actually, the other thing about microglial inflammation, it's thought to lead to a whole host of cognitive issues in terms of depression, anxiety, could be schizophrenia, and a lot of psychiatric illnesses. And we actually saw in these rats, it reduced the LPS and some of the triggers that we know for these. And basically, it's thought, hey, we maybe want to look at methylene blue in the future to reduce neuroinflammation to brain-related disorders that are related, whether it was LPS that drove it or other conditions that drive our brain's immune system to be hypersensitive. This one was really kind of neat. I know probably all of us on this call would like to have better memory or better sustained attention or memory retrieval. I have to thank Sarah Hover for this one. She sent me this one the other day. This one was really kind of unique, and this was actually done on humans. So what they did is they took and they looked at the sustained attention and memory enhancing potential within the brain, the parts of the brain where that occurs. And what they did is they administered methylene blue, and then they monitored the brain function before methylene blue and put the brain through some tasks. And then they monitored an hour later. And what was really kind of unique is that the methylene blue actually improved scores in terms of our short-term memory task recall and our memory retrieval. How often do you go through the day where you're like, oh, I can't think of that word, or it doesn't come out just right? And I've probably done that several times for this talk, so maybe I need methylene blue myself. But what was really kind of unique about it is methylene blue was actually able to increase the functional, the magnetic resonance imaging in the brain of the areas that get used during the processes in terms of attention and memory. And so once again, I don't want to oversell it. Once again, I'm not here to make it anything more than what it is, but it is something, and I have talked to some people are patients and actually friends of mine that are using low-dose methylene blue, and that's what they're saying. It's like my memory and my recall has gotten a lot better. And these are really low doses, and we'll talk about that in a minute. But we've seen that with a lot of patients, and I've heard that from several that have been on methylene blue. This was an awesome paper on methylene blue and anti-aging. Just want to talk about things we've already talked about: the oxidative metabolism in the brain, how it benefits, helps with mitochondrial dysfunction. It's also thought it may kind of help slow some of the brain aging processes. It actually showed to be beneficial in terms of protecting our skin. We've kind of talked about, can you have the ability to compound some skin products? It actually shows the ability to stimulate fibroblasts. One of the first things happen if you have a wound, for the wound to heal, fibroblasts have to go in and start laying this structure to basically allow a wound to heal. Methylene blue has been shown to stimulate fibroblasts to help with the healing of wounds. That was something in this study. A couple other studies I just want to bring up: Lyme disease. Not so much for the treatment of Lyme disease, but some of the persister activity. That means the conditions that hang on after Lyme disease, all the conditions, neurocognitive stuff, poor memory, fatigue, aches, pains, all of those type conditions. There are some studies about using methylene blue for that. Depression. This is when we talked about that neuroinflammation aspect in depression, but also keep in mind, methylene blue is actually what's called an MAO inhibitor. That's an enzyme that breaks down a lot of our enzymes that break down serotonin, that break down different enzymes and our neurotransmitters in the brain that affect our mood. So one of the neat things about that is methylene blue can actually been shown to help with depression, and it could be because of the neuronal inflammation reduction, but it also could be because of this monoamine oxidase inhibition. We've already talked about COVID. We've already talked about anti-aging. We've already talked about the neuroprotective effects in terms of how it saves the brain. There's actually a really cool study about patients with cancer who have a lot of oral mouth pain and a lot of inflammation, that an oral rinse of methylene blue reduces that pain rather dramatically with very minimal side effects. We talked about how it can help with wounds. Keep in mind, it's also an antiviral, antifungal. There's a study right here showing about using methylene blue to help treat nail fungus. So we've talked about a lot of benefits, but let's also be realistic. With every drug, there's pluses and minuses, but let's talk about some of those now. So like we talked about, it can prevent the body from breaking down serotonin. So we have to be very careful if we use this in patients who have who are on what are called SSRIs. That's like your sertraline, fluoxetine, Prozac, those type things. SSNRIs, things like venlafaxine. So we have to be super careful when we take those drugs because we can potentiate something called serotonin syndrome. We also have to be careful with an interaction with a drug called dapsone. Actually, that's used some in Lyme disease. It can affect the levels. We also have to be careful with dosing in terms of severe renal insufficiency and hepatic insufficiency. Granted, we're talking very low doses. The risks are minimal, but we have to be conscientious of that. It can be harmful to neonatals. It's actually a teratogen to pregnant ladies or females. So that's important to keep in mind. We wouldn't give it if I'm pregnant. You can have a true allergic reaction to methylene blue. But once again, most of the side effects we see are dose dependent and don't occur at higher doses. So let's talk about some other precautions. Remember how we talked about how methylene blue can ramp back up mitochondria, but it also has some antiviral, antifungal properties. It can create what's called a Herxheimer reaction. And that's a reaction where the body kind of goes into an immune, like, oh my gosh, what are you doing to me? It creates almost like a flu-like symptoms. And this can happen with methylene blue. That's why we need to kind of start out with lower doses and work up slowly. Methylene blue, actually, believe it or not, can increase a serotonin toxicity with hydrocodone. We need to be careful with that. Methylene blue also, just as a precaution, can stain tissue, skin, clothing, or whatever else it comes in contact with. If you're taking methylene blue orally and it gets passed to your system, we'll talk about some of the side effects. If you have a low flow toilet, I've actually heard reports of it actually can stain your toilet. So we need to keep that in mind. Also, too, some of the oral solutions, we may do it. It can actually stain the teeth. It's important to have good oral hygiene, brushing and flossing regularly, and that can prevent that. One of the other conditions, it's not real common condition, but there are 400 million people across the world that have the G6PD. It's a certain enzyme where the body can't break down certain things. For these patients, methylene blue is not a good choice. I know like 23andMe and other genetic testing can find this. So just keep that in mind. It's mostly a male-related condition, but this is something we really probably don't want to use methylene blue in these patients either. So let's talk about side effects. Yeah, keep in mind, it does turn the urine blue or green. That's one of the ways you kind of know that it's working. If you take a dose over time, your urine may go to a blue to a green. The green may occur because your urine is yellow. Blue and green makes yellow. So just keep that in mind. It can cause some mild headache. It can lead to some dizziness, some GI upset. It can cause excessive sweating. It can cause some mild burning in extremities. But most of that is seen if we do higher doses. It's not seen at lower doses. There are also the risk of allergic reactions. Once again, we don't see as many of those at the lower doses, but we do need to talk about that. This is the one thing, if I want to hammer home anything else tonight, this is what is super important and I want to get out there. Scarily, I went out and Googled methylene blue on Amazon, and you can order methylene blue all over Amazon. And I want you to understand there are different grades of methylene blue. Because keep in mind, remember, it can be used as a dye, but it also can be used as a drug. Throughout the processes, you have a chemical grade, an industrial grade, and a pharmaceutical grade. Chemical grades can have anywhere between 20 to 30% impurities. Industrial grade can have up to 8 to 11% impurities. And sadly, I think many of the products that are sold online right now are not pharmaceutical grade. They're this industrial grade. And that scares me, and I'll tell you why in a second. We at the pharmacy, one of the reasons we just started using or recommending methylene blue, we have the ability to get a pharmaceutical grade. If you'll look down here on the bottom, it shows its total impurities as less than 5%. That's a requirement of the chemical. The one we currently have actually has of less than 0.05%. These impurities are things like arsenic, aluminum, cadmium, and mercury, and lead. Remember how we talked about before, your mitochondria can be dysfunctional if you have heavy metal toxicity. So how frightening is it to think you may be thinking something that you want to do to promote mitochondrial benefit, and you order a product that's loaded full of these heavy metals, you may be causing more harm than good. I can't stress that enough. Do not order a product offline. You don't know about the quality. You may be causing more harm than good. Keep in mind, lower strengths, less impurities, but we don't want any impurities. So I just want to stress that if you get anything from tonight, knowing where you get your methylene blue from. I don't want to spend a crazy amount of time on this, but I do want to talk about dosing a little bit because I'd like to get to some questions as far as that goes. But when we talk about most of the dosing that's in the literature right now talks about doing a milligram per kilogram dosing, 0.5 to 4 milligrams. I will tell you, most of the lectures and talks I've heard use 0.5 to 1. We go with really low dosing. The doses we've seen in the pharmacy are starting as low as 5 milligrams. Believe it or not, you can get enough benefit on some of these conditions at a dose of 5 milligrams a day up to 50 milligrams a day. It's very patient individualized. One thing I haven't mentioned tonight is a drug called low-dose naltrexone, which we do a lot of. And just like low-dose naltrexone, we do, and it is maybe beneficial. We don't got to necessarily do quite the taper that we do with low-dose naltrexone, but we do want to start low and go slow because everybody's kind of got their own unique space where they need to be at. I will tell you also too, low-dose naltrexone and methylene blue can be coupled together. Think about this as methylene blue helps improve mitochondrial function. Low-dose naltrexone reduces inflammation. Bingo. Top two things that drive the majority of disease in our country. The other thing I'll tell you too that's kind of unique is that methylene blue can be kind of that drug to go to when we tried low-dose naltrexone and we didn't move the needle. Methylene blue may be that good choice to try as an add-on, or maybe to try it to see if maybe we can help with some of the conditions that we'll talk from fibromyalgia or some of these conditions that are hard to treat. So once again, we're going to start low, work up slowly. The optimum dose, like you said, is very individualized. For the practitioners, methylene blue has about a 12-hour half-life, which means the dose you do today will stay in the system. Say if we go for like 5 half-lives, that's about 60 hours. So we're talking a couple days. It is excreted in the urine, and that's one of the unique things that makes methylene blue. It concentrates in the urine before the body excretes it, and that concentration in the urine can actually, that's what helps it available in the commercially available product to treat urinary tract infections. So instead of having to give these antibiotics all the time to treat UTIs or as a preventative, methylene blue can be given on a daily basis to keep that urinary tract in a good antiseptic level to prevent chronic urinary tract infections. Also, too, it's really important for good absorption. Methylene blue needs stomach acid. Taking it with food is important, but I also think about if you're going to spend money for methylene blue, that if you're on a bunch of acid blocker drugs, you may not see the full benefit. It may not get absorbed as well because it really needs that to get done. And methylene blue, just like low-dose naltrexone, can be cycled. We can take it at times when we need it. Let's say we've had a stroke and we want to try to repair that brain. And the quicker we can get this on board, the faster it works. There's also some thoughts about athletes who exercise to that oxidative stress part. Methylene blue may help re-energize that mitochondria to do things. So these are just some things to kind of keep in mind as far as that goes. There are also some thoughts about doing an oral solution to actually work the dose up slowly. We haven't been doing those. We've been doing mostly capsules, but I just want to show you what's out there so that you know. I do want to let the prescribers on tonight know that if you want to learn more about methylene blue, or if you're willing to prescribe methylene blue after tonight, or you already prescribed methylene blue, I wish you would email Haley, my sales and marketing director, which will come on in a second, at haleyc@magnoliapharmacy.com. She will get your information because I have twofold purposes. One, we want to provide you all the information that you need of methylene blue. But also, once again, we had about 168 people register for our webinar tonight, and I would like to create a list of physicians that we know will prescribe methylene blue so we can refer those patients to prescribers that will prescribe it. So I would appreciate if you would do that if that's something that you're interested in and you're a prescriber and you're on tonight. So before I kind of end tonight, I want to talk about a couple things. First, I wanted to say thank you to Sarah at PCCA, Sarah Hover. She's a pharmacist, great friend. A lot of the information I pulled tonight was from one of her talks. The other thing I want to talk about, like you said, Dr. Mobeen Saeed, he had a couple of different lectures. If you want to learn more about the science of methylene blue, all you got to do is go put in his name of methylene blue, and it goes into way more detail than I went in. But it's got some great information about methylene blue and the ability and how it actually works in the body, because that's what's important to me. I want the science behind things work. I don't really care if, anecdotal stuff's important, but I will tell you there's becoming more and more studies out, good quality studies showing about the benefit of methylene blue. So in our own pharmacy's behalf, I'm going to end my presentation there. I'm still going to talk. I'm going to take away the screen share. I want to just talk about a couple other issues. So let me stop the share. I want to kind of go into a couple different things. So one, currently we are compounding methylene blue capsules. We've been doing a lot of 15 and 25 milligram doses that allow patients to start low and work the dose up. In our lab, I will tell you, it is a challenge to compound. And what I mean by that is this stuff turns everything blue. And so there's about a 2-hour clean that has to happen before, about a 2-hour clean that has to happen after, so that we don't contaminate any other work surfaces. But with that said, we are doing that. We're taking our time. We're all about quality. We have a good quality source of methylene blue. So that's one of the things to let you know we're sticking with. We have the ability to make a couple other strengths, but that's kind of where we're sticking at right now. The other thing I want to stress is that we are looking at methylene blue, because the quality of the chemical that we spend, and you can go online and look at this, there's prices all over. Methylene blue is probably one of the more expensive compounds that we do. I really am very cost conscientious while keeping quality as part of that. And methylene blue is one of those things that cost me a lot as a chemical to buy. I would say a month of methylene blue as a compound is probably going to run you between $90 to $100. There are some cost savings in getting a 3-month supply. A 3-month supply of methylene blue will probably run you closer to once again, there's some cost savings anywhere probably between $180 to maybe $210. There are some cost savings. I will tell you, there's a lot of data about pulsing methylene blue, doing it for a while. It stays in your system and getting off. That may be one way to keep some of the costs low. There's some thoughts, maybe you don't have to dose it every day. Like you said, urinary tract infections is probably something you want to do, but some of these other neurocognitive conditions, we may be able to do every other day dosing or do it for a week, take a few days off. There's some different things to look at about trying to do it that way. But with that said, I just wanted to kind of offer that up as some suggestions. At this point, Haley, if you want to pop on, and we'll try to go through as many questions. I'm going to hard stop at 7:30. If I don't get to all the questions, or there's questions that we don't get to, I will put out an FAQ that will go to everybody that registered for the webinar. Just want to let you know that too. Haley, are you on now?
Yeah.
Awesome. And if you're not on mute, I need you to be sure your phone is on mute so we can have good clarity so everybody can hear.
Yeah, thank you to everyone that could join us tonight. Okay, I did see a question from Lauren Olson, and she wanted to know, how is it different or alike from an antioxidant?
So methylene blue is like an antioxidant. It scavenges up reactive oxygen species. So think it as one of the benefits of methylene blue. It can work as an antioxidant. And keep in mind, when we take antioxidants, or methylene blue scavenges up antioxidants, scavenges up free radicals or reactive oxygen species, that tells the body, hey, everything's okay, calm down, immune system, no inflammation. It's when we have a plethora or a high amount of these reactive oxygen species or free radicals, immune system goes on alerts like, hey, we got to do something about this. But that's how methylene blue works in that sense.
Okay, and then the next question was, Dr. Valina wanted to know about a methylene blue and infrared light and the use near it.
Yeah, so there's a lot of great data. I didn't even get into that. I had so many articles to go through. You can put in methylene blue and infrared light. There's a lot of things for usage of skin cancer. There's a lot of other conditions that have shown beneficial in terms of some of the topical uses, but then also too about dosing methylene blue and exposing the person to light. You get a whole added benefit that has to do with this whole electron transport chain and the mitochondria, how it functions. Once again, I didn't get into that tonight, but there's some great information. Once again, if you'll email Haley about that, more than glad to get you some of that information when we're done.
Okay, and then Dr. Monrose would like to know, what is the average starting dose for adults?
Yeah, so that's kind of changed a little bit in the last couple of months, what we've seen. Right now, we're telling most patients, once again, it's 0.5 to 1 milligram per kilogram. So you can do the dosing, which puts you up there. But I will tell you, we are seeing clinical benefit. Right now, we're sticking with a lot of 15 and 25. I've got some doctors that'll do 15 and 25, see what the response is like. If they don't get a good response or they're having a great response, we'll stay there. But if we're not seeing what we want, we'll double the dose. So then we'll go to a 30 or a 50. But I will tell you, I was reading some articles this week and I was talking to a friend of mine. They're starting as low as 5 milligrams. Once again, dramatically reducing the risk of side effects, but seeing some benefit in this neurocognitive sphere, but also on that brain recall sphere. So those are just some things. So I would say anywhere between probably that 5 to 25 milligrams starting, depending on how fast we need to get it on board, where we want to start. But those are the doses that I would start with.
Okay, and then Dr. Ward had a question. Can you compound low-dose naltrexone and methylene blue together?
So that's a great question. We could, like I mentioned before, for us to compound methylene blue and make quality, I can't go in and make 100 different things. So the idea of putting them together is fabulous. And there's some thoughts about doing that. The problem with it is, and this is something we may add over time depending on what we see, the problem with that is it just means more times in the hood, more of a mess. So right now I'm going to say we'd like to keep them separate, but I'm not saying we can't do that in the future. One of the things we kind of learned about this week was some of the pharmacies have been making troches, which is a little dissolvable in your mouth. But instead of dissolving your mouth and turning your mouth blue, it's another way to put the troche into a liquid form before we make it, so it doesn't create so much of a powder problem. But what we're finding out, these troches, if they're heated in any way, we're finding out the heat breaks down the methylene blue. And so just keep that in mind. If you're getting a troche from somewhere else, you might want to ask your compounding pharmacy about that, because there's some new studies coming out that heat breaks down methylene blue. So right now, we're going to pretty much stick with capsules. The ability to compound may be limited in terms of the combinations, but it is definitely something we can look at.
Okay, and then Dr. Valina had another question. What is the difference with capsules versus solution or drops bioavailability enhanced with delivery using nanoparticles?
Well, anytime you can throw a nanoparticle that's in, most compounding pharmacies don't have the ability to put nanoparticle technology into a compounded product. There's a lot of supplement companies that do that, but that's a very high dollar technology. Our ability to do that. What we've seen through our patient use, though, is one, the methylene blue we have is very high quality. When I tell you it's 5 milligrams of methylene blue, we weigh it out, it's 5 milligrams of methylene blue. Like I said, it doesn't have 8 to 11% impurities in there, which means the patient isn't getting 5%. They could get as low as 4.2 or whatever else. And what we've seen, like I mentioned, is there's some thoughts about taking vitamin C and making sure we have adequate stomach acid on board. That enhances bioavailability. And the way I know it gets absorbed is this. I've seen some patients tell me they'll get some of the methylene blue off the internet and they don't even have a discolored urine. Well, I can tell you what the compounds we're seeing and things we're doing. People are seeing blue urine, and they're seeing blue urine for several days, knowing that it is getting in the system, being there. So that's a great question. Our ability to compound it in capsules and liquid, I think, is pretty similar. I don't think you have the solution does give the ability to be able to titrate the dose, but then you've got to deal with all the oral aspect about the bluing of the tongue and the bluing of the teeth and good oral care. That's why, to me, at this point, the capsules is kind of the best of all worlds, but that's kind of where we're at right now with that.
Okay, I think that, okay, hold on. Is there a replay of this available? It will be recorded and we will push it out once it becomes available to us in Zoom. Did anyone else have any other questions? I think that looks like it's all for now. Could absorption be enhanced if methylene blue was taken with something like apple cider vinegar?
Once again, in an acidic environment, it's going to help it be absorbed. So it's probably not a problem in doing that as far as that goes. And I do want to say, just kind of as a close, as with everything we do here at our pharmacy, we're all about quality. I'm not in here to treat any medical conditions. I'm not here to be your doctor. I'm just here to give you information so you can make good, educated decisions about your health. I know so many people nowadays struggle with neurocognitive issues, and that's like the big thing for tonight, and for whether it be, behavioral issues. And I really think methylene blue is something we need to look at. I think it's very safe if it's dosed properly and monitored correctly. That can have a really big benefit in terms of making sure you get a good quality outcome with very minimal side effects. It plays very well with a lot of other drugs, a lot of other things we do on the wellness side. And once again, it's one piece of that puzzle. If we don't go after a wellness approach, taking care of the body, once again, from nutrition to looking at underlying other issues, good supplements, balancing hormones, making sure thyroid functions adequate, methylene blue is not going to, be the end all be all, but it can be a big part of helping turn that corner to get things moving in the right direction. So I appreciate everybody getting on tonight. I appreciate your time. I hope you found this interesting. If you have, I'd love to hear from you. You're more than glad to email me. Like I said, my name is Steve H. My email is steveh@magnoliapharmacy.com. You're more than glad to put stuff out on our social media sites. I'd love to see your comments about the webinar. Haley will put where this will be at later so you can check it out. Please share it with your friends and family. Share it with your practitioners. Your practitioners, like you said, if you need more information, I highly encourage you to follow up with this after all this is over. But other than that, that's all I got for tonight.